Hello everyone, I'm Matthew Winn and welcome to a new episode of Leadership and Culture in Healthcare, your weekly podcast on all things in healthcare to do with leadership, funnily enough. This week's going to be slightly different. As you know, we are working our way through NHS organisations, talking to chief executives whose staff tell them they have a good culture, a good organisation based on the staff survey results. One of my organisations is Cambridgeshire Community Services Trust, and because I didn't want to obviously talk about myself, which would be very odd, I have the delight of talking with Anita Pisani, who is Deputy Chief Exec. Anita, say hello, introduce yourself, let people know what you do in the organisation.
Okay, hi there. So I'm Anita Pisani. I'm Deputy Chief Exec, but also Workforce Director here at Cambridgeshire Community Services. And I've been here since June 2012, which is just amazing. So nearly 12 years. And I joined the organisation from working in a small acute trust. And prior to that, I've been in the NHS since the early 90s. And have worked in all sectors: mental health, learning disability, acute, commissioner, provider. But my heart is in community services, as that is where I see myself now.
Brilliant. And while this would be a bit odd because both of us know our organisation very well, so you're not going to get away with anything in terms of what we talk about and vice versa. So just from your perspective, and then we could maybe have a discussion about this, what do you think is the culture in the organisation that the staff clearly rate to give it really good outcomes in the staff survey results?
So I think our culture is a very open, transparent culture. People can share what they truly feel and think. Very approachable organisation, don't shy away from acknowledging when we get it wrong. And I can think of a couple of examples over the years that you and I have had conversations of, stop, I don't think this is going in the right way. Truly listen to feedback from our people. And I think our leadership, our collective leadership in the organisation is very visible and very approachable. And I think that creates an environment where we hear when things are going really well, we hear when things aren't going so well. And actually people are really proud to work in this organisation, and we've seen that over the years in various different conversations that we've had.
Interestingly, when you look at staff survey results, that what you've just described, which we'll get underneath the tin of, isn't the norm in every NHS. It's clearly prevalent in lots of organisations. So how do you think that's come about? So you've talked about listening, you've talked about people being proud, you've talked about people being honest and transparent. To me, those things are about trust. Mm-hmm. So how have you seen that being engendered and developed as an ethos in the organisation?
So I think trust is vital, psychological safety is key, and I think we've paid attention to it over the years. This isn't something that's just happened in 2022 with our results. It's something I think we've collectively worked on, probably even before I joined the Trust, but definitely since I've been here in 2012, we've had a real clear view of having highly engaged people working in our organisation is fundamental to delivering fab care. We've used the evidence base of Professor Michael West, and I remember the first sort of presentation that I did with the board back in 2012 after those sets of staff survey results is we did use and we talked about the evidence base. And actually that key link between staff experience, staff engagement, linking to better patient engagement, better patient mortality. And we use that evidence base with our clinicians, with all of our people to talk about why we do certain things and why we pay attention to certain things. And we were really privileged to have Professor Michael West come and talk with our leaders a few years ago. And I still remember to this day, you could have heard a pin drop in that conversation, because actually you look at the correlation of his evidence base of working as an effective team, being listened to, being valued, is actually that just leads to really great teams delivering great care.
So you've said two things there, haven't you? You've talked about the board being aware and being briefed and being educated on what's needed.
Yeah.
which is important. You've talked about Michael West or professors. I don't normally hear you using people's titles, so it's very impressive. You used Professor Michael West twice, but Michael came and talked to our staff, and they heard it, and obviously only a small number of our staff, but they heard it straight from the horse's mouth, so to speak. But what else practically? Because those are two in kind of in inputs into the organisation. How else, therefore, have you seen that approach of great experience, great engaged staff getting to better outcomes, as you describe? How have we got that sorted?
So we focused on acknowledging that the board are only one part of the leadership of the organisation. It's actually about all our leaders in our divisions, in our services, making the decisions, making the vision, actually getting on with providing our services and feeling empowered to do so. So again, we had some quite purposeful things that we've done over the years. Is one programme of work within our people strategy, and it's still there today, 12 years on, is a highly engaged workforce. And that is a programme of work that I think will always be there and need to be there, because you can never engage enough. And you hear me say many times, it's all about the conversation. Let's talk.
Oh, you say that a lot. It's all about the conversation.
It's all about the conversation.
Which is why I was worried about this conversation, frankly.
Because it absolutely is. And it's about, let's talk things through. And, you know, we are people, we are human beings, we will get things wrong. But let's talk about it when we do. So we made some purposeful changes in the organisational structure. We're quite a unique organisation. We're called Cambridgeshire Community Services, but actually we provide services across the width really of the east of England. Not all the same services everywhere, but we do operate across lots of bases, across a huge geography. So we did pay attention to developing our leaders within the different clinical areas and empowering them to lead their divisions, and then working with us as an exec team, with us as a board, as and when they needed us to. So again, we introduced a few purposeful things along the way. We introduced something that we call wider exec, which is where we get together on a monthly basis that's all the exec directors, but then it's everybody else who runs our services, and we collectively talk, learn, share, develop together. And we spend quite a lot of time looking at our development, looking at leadership, talking about the importance of compassionate leadership and what that is. We also introduced a quarterly leadership forum in the organisation where we got together, upwards of about 100, 120 of our leaders get together on a quarterly basis, and that's an opportunity for people to share and learn. And that's where we would talk about our staff survey results, our staff feedback, where we're doing really well, and as always, doesn't matter how good your staff survey results are, there's always room for improvement. But we talk about that collectively. It's not the world according to Matthew, Anita and the execs, it's the world according to our leaders across the organisation.
Yeah, and so you talked about a couple of kind of purposeful interventions there. So fora getting together, so all people are having one conversation together, all understanding it. You mentioned about making some structural changes. What else was kind of structurally altered to make this happen?
So we introduced the role of service director that led each of our clinical divisions, and then they had their own local leadership team. We have a central support service function in the organisation that works across the breadth of our organisation, and they lean into our clinical services, and we align. So, for example, human resources, financial, quality, communication, support functions into each of the divisions that pay attention to the local priorities and improvement areas, as well as what we tried to create as a trust. The other thing we introduced in probably 2013-14, it was just after I joined, is we introduced an objectives cascade process in the organisation, because we all know everybody, to feel fully engaged and motivated, is you need to understand, why am I here? What's my purpose? How do I help this organisation, my service, my team deliver why we're here? So we have 4 very simple trust values, which were developed with our people prior to me joining. Actually, I think it was 2011, and I know it was through conversation with around 1,000 members of the team about actually what resonates for you. We have the NHS Constitution values, and they will refreshed in just before 2011, but then the organisation had conversation, what resonates for us, how do we want to operate? So we have 4 very simple values: honesty, empathy, ambition and respect. And we talk about those with our teams, with our individuals. You and I go on every welcome event for the induction and meet every new member of staff. And we don't talk about the technicalities of people doing their role. What we focus on is how we do our role, and actually our values and our behaviours, and actually what we expect from every member of staff. But also we ask for feedback. So actually nothing better than new members of staff telling us what it's really like to work in CCS. So we use that as an opportunity to again have a conversation, get some feedback, and then to do sort of continuous improvement. Then what we did with our values, and then as a board, I think probably about 3 or 4 years later, is we reviewed the strategic objectives of the organisation. And again, if I remember and being truly honest, the original objectives of the organisation, if you were to ask me to tell you what they were, I could not tell you because they were long sentences.
Absolutely shocking. We'll have that in a one-to-one at some point. Yeah.
Absolutely. But I couldn't remember them. And actually, so if executive directors and board members couldn't remember them, it's really tough to expect your 3,000 members of staff would remember them. So again, purposefully, we had a conversation at the Trust Board to say we need to make this simple. We need to talk about what it is, why are we here, what are we here for, and what's truly going to engage our people. So we came up with 4 very simple strategic objectives. 2, I would say, are on par with each other. It's providing outstanding care and being an excellent employer. 1 isn't more important than the other, because again, going back to the evidence base of Michael, is you need both to create great services and provide great services. We also then have 1 around being collaborative, because being a community provider, we have to collaborate with our whole system, with the voluntary sector, with other organisations, with education, with all parts of the NHS and health and local health authorities. So collaborative is really key, and collaborative with each other, because again, the evidence base, we are a team. Teams work together, teams working together well, having constructive conversations leads to better environment and better care. And then our 4th one is being sustainable. So that's about making sure the money balances, but more importantly, it's our carbon footprint, it's our sustainability as an organisation. So we have those 4 very simple strategic objectives. And what we do on an annual basis is sort of January, February time, you'll have a conversation with our chair and you'll agree your objectives along those 4 areas. You will then work with each of the exec directors, and we have a cascade. And what we say to people is not everybody has to have an individual set of objectives, but actually every team or service should have what actually happens. What do they do that sits in line with those 4 strategic objectives, and have an explicit conversation around our values and behaviours, so the how we do it together as well.
So that's interesting. So there's methodology, there's purpose backed up by the evidence base, but very much focused on a process that drives all those things. And I guess we often talk about in the organisation, don't we, about 100 nudges or 1,000 nudges. This is not one intervention. It's about nudging those things all the time. I'm always taken by induction, because you and I spend probably 45 minutes there. We don't just go and say, oh, hello, we're the leaders, and then get lost. And we talk about how the organisation operates. And you often, I can see you on screen because we do it virtually now, wincing sometimes at what's Matthew saying now. And I never do that backwards, of course. But that point is we always talk about how we want people to behave in the organisation, how they can be part of making the culture, but for a very key purpose, and the key purpose is delivering our outcomes of great care for local residents. There's no other purpose for the organisation to exist except to do that, and that's quite hard to get right with everybody, isn't it?
It is, yeah. And we also have the conversation every time around the key relationship we all need to have is with our line manager. That's where psychological safety starts. And if everybody could have a fab relationship with their line manager, oh, how great life would be. But we're also realists. So we actually also say to everybody who joins us is we recognise at times that might not be possible for whatever reason. is actually what we say to everybody who joins us, and we say it to our existing workforce, is if you're worried or concerned about anything, talk to somebody. And there will never be a wrong place to talk. So we would never say to somebody, how dare you have approached X, Y and Z. Is the most important thing is to share your concern, share it with somebody, and then we will get that into the right place and address it.
Which is interesting, isn't it? Because the freedom to, this veers into the freedom to speak up culture. Yeah. And I'd say in our organisation, we treat it as a mechanism, and sometimes a formal mechanism for people to raise concerns, but generally only if you can't get your voice heard somewhere else. And we don't have a full-time guardian, do we? You're the exec lead. And it's interesting when I read about other places, there's a lot of angst about the freedom to speak up, this kind of, is it impartial, is it not? I noticed some trusts the other day were asking other trusts to have guardians on their behalf. And I find that quite an anathema, because it's about the culture, and you're the exec lead for freedom to speak up. So how do you personally weave that kind of balance of being the executive lead for freedom to speak up? You're also deputy chief exec, you're also the HR director, and get that balance right of dealing things culturally, formally, informally, and ensure that people are listened to, because that's quite a tough thing to pull off.
Yeah, it is. So we do have a Freedom to Speak Up Guardian, but it's embedded in our Trust Secretary role, and they link directly with me. And I hope if Sarah was here, what she would say is I provide her with psychological safety when people speak up to her, because sometimes people will have a conversation with Sarah and only want to have that initial conversation, don't necessarily want to be known as an individual, but want their concerns addressed. So Sarah can talk to me, and I don't need to know who's actually spoken to her, because the most important thing for me is about addressing the concern in the best way. And then between us, we would work through, well, what's the best way of taking this forward? Sometimes concerns that are raised maybe sit within the HR arena. So actually it is quite helpful that I'm also the workforce director, because I can manage that in a really confidential, safe space and a safe way. There will be things, Matthew, that I know about this organisation that you don't know, and that's right, because
that's
actually,
surely not true. Is that really? No.
But that is important to provide psychological safety. We do absolutely share the themes. We talk about the learning as a trust board, because a major part of our role as a trust board is to understand what's going on, but we don't need to disclose exactly who said what, why, and where. And then Sarah and I will work through the best way of taking the concerns forward. And I'm thinking of, the last few months of things that have come up. I think I'll be right in saying people who start off having a conversation with Sarah wanting to be anonymous, she creates a really great psychological safety for them. And then actually we are able to have much more of an open conversation. And I do generally know then who's raising what, where and why, and we work together to address it. You and I have people speaking up directly to us, which I think is really healthy and is really great. And again, we've had, sort of that via email. We've had people just chat to us. One of the key things I think of being a leader of an organisation, this is leadership at every level, is being out there, being visible. Just go and sit next to somebody and say, hi, how you doing? It's amazing what people tell you. Because actually it's about, we are human beings, and work with people on a human level. It's not the job title, it's, I'm Anita, how can I help?
Yeah. And there's I don't know if it's a mantra, but there's definitely a theme that we always talk about, especially with our new recruits, is talk to someone. It actually doesn't matter necessarily who we talk to, but for goodness sake, if you're worried about something, either about patient care or staff engagement or staff issues, just make sure that you talk to. And there is, I think that is a cultural issue of, our exec don't have their own rooms. They share a space. The door nearly is always open. In fact, people would prefer it to be shut, I think, most of the time, given that people, especially you, are quite loud. And I'm always quiet. But actually, people should be able to approach and talk about these things, shouldn't they?
Absolutely, yeah. Absolutely, definitely.
And on the freedom to speak up, it's interesting. I rarely get to know or need to know, and probably that's more important, about the freedom to speak up issues, apart from when it's a serious issue about the quality of care or about clinical people or whatever it is, where it becomes an important formal process. And interestingly, Sarah has involved me very rarely, but occasionally on things that she didn't want to involve you on because that was appropriate. But it's a rare issue, isn't it? But on the whole, it is kept in a very confidential right box, isn't it?
Absolutely. And the other person we have that works alongside Sarah and I is one of our non-exec directors. So we have Catherine, who's one of our non-execs, is a non-exec lead for Freedom to Speak Up. And what Sarah and I do a couple of times a year is we will have a catch up with Catherine and we'll talk through in a little bit more detail some of the sort of themes and aspects that have been or concerns that have been shared. And we also, on an annual basis, we have a developmental session with Sarah, Catherine and I with our Freedom to Speak Up champions. We have about 23, I think it is now, volunteers that have come forward across the organisation who want to be a Freedom to Speak Up champion. And they're individuals also available for our people to talk to if they have concerns. We've done it entirely voluntarily. There's no selection process. If you want to be a champion, you can be a champion. Please come forward. And again, we do promote that at all of our induction sessions, and new people continuously come on board. But at this annual session, we just use that as an opportunity to learn together, hear from the champions what's worked well for them, anything else they're seeing in the organisation that we need to pay attention to, and anything else they need from us to support them to do their role.
And looking at the staff survey results, so now we're recording this today, we have the benefit of clearly 22, 23, but we've also got 23, 24 that have been announced a few weeks ago. You in each year you change your personality profile and delve into the staff survey results and look at the spreadsheets. Any time in any year that I ever see you get interested in data in that respect, and you come out with, this is some themes. But you live and breathe this all the time, Anita. What are you pleased about in terms of our staff survey results at CCS, and where do you think the challenges are for our organisation?
So I'm really proud around the continuous improvement aspect of it, because yes, I do, you're right, I do become very blue at this time of the year, and I look at data and I look at other people's data, and last year and also this year we were rated top or joint top in most of the people promised domains, which is really great, and I'm really proud about that. But that's a lot of hard work from a lot of people and a lot of focus on, actually it's about putting people first. So I'm really proud around that. This year's results, 23, what I'm really, really proud about is that in every domain we have seen an improvement on last year internally. And I think that's all you can ever do, really, is focus on improving yourself and that continuous improvement aspect. And a couple of the indicators which sit under the staff engagement, recommending us as an employer and recommending us as a place to receive treatment, again, were really good. So 75% of our people recommend us as an employer, and just over 82% recommend us as a place to receive treatment. That's fabulous to see. But again, I always look at who's not recommending us, because again, I don't sit back on our laurels and think, that's great, we don't need to do anything, because there are still percentages in there that aren't saying they recommend us. So actually, let's look at what that's about and just see if that's in any particular areas. The couple of areas that I am really proud about is we are compassionate, inclusive, and we have a voice that counts, because those two things to me really, really give us some assurance as a board, as an organisation, that we are getting some things right in that leadership and culture space. And as I say, there's always room for improvement, and I always say that when I present the results to the board. But actually, generally, we are getting good feedback in that space.
Yeah. And so on the areas where you can see still needs improvements, that might be a team level, it might well be across the organisation, and I know we've talked about understanding those groups of people whose voices are not necessarily heard so much in the staff survey. So I'd think, still not enough people on non-registrant level, healthcare assistants, some of our administration teams probably aren't filling this stuff in and giving us feedback as much as others. just help people understand a little bit of the approach that we take to then say, look, these are the improvements we're going to make? Because we try to be really focused, don't we?
We do, yeah, because again, you get such information and a plethora of data comes through each year in the staff survey that you could get lost in that and try, but one thing we have learned over the years, and I would say we've been doing it for at least the last 7 years, is we don't try and change the world on the staff survey results, is we talk about what are the sort of 3 to 5 areas as a trust, as organisational wide, are we going to focus on? And then we track those improvements. So what I would do is when we get the following year's results, is I then check in on those questions that people promised to make against the improvement target, and have we made progress? Because actually, if we haven't made progress, we're choosing the wrong things to do, I'd suggest, and we need to rethink.
Or not doing it very well.
Or not doing it very well, exactly. Must try harder. Yeah, exactly. So it's about really being purposeful, really being focused. And you asked me earlier about some of the challenges we had. I don't think I quite answered that, but I was thinking around, so some of our data in workforce race equality and workforce disability equality standards, it was really great this year to see lots of improvement, but there was a couple of indicators that had gone slightly in the wrong direction, but also in general, they're still not good enough. There is absolutely still more that we can do in those spaces. But I think as an organisation, we talk about that. We have staff networks that support in those areas. And I will go and talk with our culturally diverse network about the workforce race equality indicators and the feedback. And we will collectively agree what we focus on in the coming year. Again, it's not going to be something the exec team, the HR team, the board decide. It will be sort of co-production with our staff networks. And we also have a disability network. Again, I'll go and talk about the workforce disability feedback and indicators, and we'll work through together what's the most important thing to pay attention to. And again, when I looked at this year, tracking the areas of improvement last year into our 23 actual results, really pleasing to see we are making progress in the right direction in all of those. But there are some of those improvements that I think will still be in this year's improvement area too, because some of these things you can't change in a year, in a few months. It's incremental change. It is those thousands of conversations and nudges that need to take place.
And this is a long game, isn't it?
It is.
There's nothing short term in altering that culture or even then sustaining that culture, is there? Yeah. I remember a chief exec quite a few years ago now was about to have their CQC assessment and had been doing clearly some Googling and rang me up and wanted to talk about the culture that our survey results had clearly started showing, and said, how have you done it? And because we're about to be inspected, and my rather flippant but honest reply was start 3 years ago, because nothing changes overnight, does it? In that respect, you've got to really put the time in. This is a bit of a daft question given what we've just been talking about, and I know you, I know you well, so this will be a hard question because it's talking about you. What's your personal impact? I guess turn it around. How do you like to make an impact in the organisation? And we're talking about a positive impact here, just to be really clear. But how do you do that to make a difference in all of this work?
So I think you're right. I don't like talking about myself, but so for me, it's treating people as humans. We are humans, we're not machines. It's actually paying attention to the whole person. The impact I like to have is, I would hope, and I have had some 360 and had feedback, is that I'm approachable, I'm visible, I'm authentic. I am what you see, Matthew. I am the same every day, I think. I'm pretty calm. Hopefully people would say I do listen to their concerns. I don't intervene when actually that's not the right thing to do. So yeah, I think visibility, authentic. I'm very can-do, and I have had feedback over the years, which I do listen to, but doesn't necessarily change the way I am, is I can be off the scale on optimism. And those that have worked with me will say, hang on a minute. But I always think, just really go for it, be optimistic. I am also a realist, though, that we won't always get there. But come on, let's try. Let's really try. Let's galvanise the efforts and really work together on trying to achieve really great things together. I am about together as well, and as a team. I'm not really the best sort of person working on their own, so I do work better with people. So I think that's probably me.
Yeah, I think you've missed out dogmatic, and I think you've missed out.
I can also be stubborn.
You can be stubborn. We can all be stubborn.
Yeah.
But I think it's interesting.
For the right reasons.
Exactly. I was about to say that only when it makes sense. So if you as a leader have a particular style, and you know your style, we all know. I mean, everybody in the organisation knows your style, Anita. How do you get different voices around you to make sure that you're seeking views that isn't just about your style? Because that's kind of, when we talk about inclusivity, that's really important when it comes to leadership, isn't it?
It is. So I really do make an effort to spend time with people who aren't like me. I know I am pretty self-aware. I've been around quite a long time now. I know my areas of development and potential areas that I could miss. So I have purposefully, people who directly work with me, I have purposely appointed people who are different to me, who actually so we complement each other. I also do make an effort in the organisation, as I say, to go and talk with people who I know would have a different view to me, and have a good debate, have a good conversation. And on things like 360 feedback, appraisal feedback. And recently we've been doing some work on cultural competency as an organisation in one of the systems that we work. And in there you were asked to get some feedback on your style. The easiest thing to do is to pick people who you know really like you and actually, rate you. I was purposeful in just having a few people who maybe we've had some challenging conversations in the past, because I think that's the greatest way to learn and actually see because we could always still improve every day. None of us are perfect. So actually getting that feedback just enriches us and makes us more self-aware.
Yeah. And part of leadership is about what we do outside of our organisation, not just in, because inside is hard enough, but it's manageable. It's done within a frame. It's stuff that we know and there's more under control. And therefore thinking about leadership and creating the culture that you've been describing that we have worked really hard on at CCS over many, many years, how does that translate into things that you do with other organisations? Because you mentioned earlier that our type of organisation is interwoven with primary care, social care, education, acute care, just mental health, just about everybody, because we have to be.
Yeah.
How does that translate into, I don't want to use the term system leadership because that means nothing in many respects, but you working with others?
So I really enjoy working with others too, outside the organisation. I love working with people who do different things to me, working in different worlds, doing different things. So I have stepped into the space in two of the systems that we work within, because again, our organisation goes across many systems, and I actually lead, on behalf of the system, their work on leadership and culture too. And that's working with all of the different system players in those systems across health and care, voluntary sector, primary care, where we talk together about how do we create the leadership and culture to work in a system way, and that actually that we can operate both in meeting our own organisational objectives and strategy, but actually we work in a way that we deliver the system strategy too, and actually have a shared vision. I'm not saying it's easy, because it's not easy, and that is many, many conversations, because again, our lenses and where we come from and where our organisations are in different places. But I do thrive in that environment. I really enjoy it. I probably am quite tenacious, I would say. Going back to my stubbornness around, I don't let things go if I think it's the right thing to do, and I do focus on doing the right thing, not just doing things because there's a diktat that we need to be doing things.
Yeah. And therefore, thinking about all that work that you do, and I see you, and now I work across 2 organisations. I rely on you as ever to lead some things in CCS that I can't put the energy on, given I work for Norfolk Community as well. So you've got a lot on your plate as a leader. You're deputy chief exec. You're doing system work. As an individual, then how do you sustain that as a person? How did you get that balance?
So I think, to be really open, I don't always get the balance right all of the time. But I've grown up, as in how I operate and my maturity in my role. So I also now know is the first person you need to be kind to is yourself. And they're conversations I have with people that I work with and with our leaders is actually none of us can do everything all of the time, because we can't. It's impossible. So it's about being kind to yourself. It's about my husband is amazing, and he will know when I'm going off.
I think we should call him a saint. Let's be honest, shouldn't we?
Yes. He's stuck in there, but he's really great at keeping me on an even keel, because he can see when maybe that work-life balance is going a little bit off key. Also, I have 2 beautiful daughters in their 20s now, and they've obviously grown up with me growing up in my career and have seen the best and the worst of me in that scenario. So again, they're really great at feeding back. And we have a great team here, Matthew, is, people do look out for each other. And I know, because again, going back to us, we are human beings, not machines. There will be at times stresses and that do become higher. Is team members, colleagues in the organisation just reach out to you. But I'm definitely much more, at this stage of my career, I'm much more in control of that work-life balance and realised, I can't do everything every day and finish everything, just be a bit more realistic. And because of my optimism bias, I have learned also how to manage that in a more realistic way and not see that as failure, because that, one of the things being quite optimistic, and I am quite competitive in my personal life, as in team sports and things like that, is I just need to keep that managed. But I'm aware of it now, and you and I would talk, wouldn't we?
We would.
I would tell you.
You would tell me, yeah, absolutely, and occasionally listen. But dare I say it? So that's a revelation for me anyway in this conversation. But the team know when to avoid you when Liverpool have lost a football match as well.
Exactly, that's definitely when to avoid
you are a
me,
grumpy person on that time, and I know those that know Anita would kind of go, really? Yes, it is. So, you're great at also fostering people becoming leaders, and we've got plenty of leadership development programs in the organisation across regionally that you sponsor as well. What as we come to the end of this conversation, what would you say to people who are embarking on their leadership within the healthcare world? It's not just the NHS, the broader healthcare world. What would you say to them without sounding too old and too fussy about these things?
I'm really old. I would say just be true to yourself. Do what motivates you, you enjoy. We spend a lot of time at work. We spend a lot of time in the workplace. So really make sure you're enjoying it. Work with great people. And I remember in my younger days, and I was really lucky. I worked with 2 or 3 people who were quite pivotal to how I then operated in later life. Is just embrace the challenge. Don't worry about not having all the skills and experience to do something. If it's something you want to do, go for it. And actually, we can all learn different things. And over my career, I have led some things that you'll think, really? So I have led IT. I was the CIRO, Information Governance Lead in organisations. And you think, really? And I had no experience in those areas, but it's not about actually having the expertise in everything. It's about paying attention to how you lead others. And actually, you'll have experts in your team who can do that. Let them do the expertise. And also be kind to yourself. That is the thing, I think. It's the biggest critic in life, I think, is you as an individual. And don't be overcritical of yourself, because none of us are perfect. We will make mistakes, but do you know what? When you make them, recognise you have, say sorry, and move on.
And finally, I guess it's just slightly looking forward, the healthcare world is under huge pressure. Our organisation is, every organisation is. We've got angst in society all over the place. What are you looking forward to in your professional space? Because if I turn this around slightly, if I look at just to be slightly proud myself, we look at our staff survey results. I think top or joint top out of 6 ads and 9 themes this year. As you say, things are all just about everything is slightly improving. There's only one way down. That one way approach is to go down after all that, though. But put that aside, what are you sitting there thinking? This is what I'm looking forward to. This would stretch me as a leader.
So I think it is just focusing on still trying to keep that improvement. But each year, as you say, that does get harder. And every year I do take a deep breath in that October to December period, thinking, is this the year that things are going to start to go in the wrong direction? But I think the thing that keeps stretching me in the people space, which is what we're talking around, is I had all my teams together on one day this week where I was just talking to them about the things that they do and actually how they influence the culture, the ways of working in the organisation. And actually just stretching them a little bit more all the time about, so what else could we do? What more could we do? We're in that customer service space, so we're here to support the organisation to be fab. So things that stretch me is thinking about doing things a bit differently, learning from others, but also enabling those within the team to really fly. I could see some of the leaders in the room this week is they were taking the initiative, they were taking the lead. Why don't we try and do this now? So I think the stretch is to keep that continuous improvement, keep the conversations going locally with everybody, and just focusing on the right thing. I always say to people, just do the right thing. If we do the right thing on a human level, we will keep the organisation culture in the right place.
Yeah. Anita, we've covered a lot of territory. We've covered a really heavy focus on the evidence base, pulling on Michael West's work, Professor Michael West, sorry Michael, just to be really clear. The evidence base, making that absolute link of experience and engagement of our staff, getting better outcomes for our local residents, our patients, that is a really guiding principle, making structural as well as cultural changes in the organisation. Enjoying work has come through quite massively, getting that work-life balance, having people around you that will have honest conversations with you, and also just making a difference every day in those hundreds and thousands of nudges that we do. Thank you for sharing your insights into CCS and contributing to this podcast, Leadership and Culture in Healthcare. Anita, thank you.
Thank you.